Hey everyone, Dr. Josh Jagoda here, and today I'm going to discuss treating finger and hand pain, specifically a lot of times in activities where there's overstraining, or if we fall on an outstretched hand. What happens sometimes is our fingers get bent back all the way just like this, or we overextend a few of them and we get a lot of pain through the fronts and the backs of the knuckles here, and then that can create some other things. So what you'll notice when that happens is sometimes you'll get bruising around the knuckle, you'll get some swelling, you'll get like these types of pains that go up and down in between these muscles or in between the bones there, and that's where a lot of the muscles lay deep into that hand. The hand will eventually curl up into this tight position, and it may even affect some of the hand, the palm, the wrist, and maybe even the forearm here. So what I'm going to do today is something very simple, but I'm going to start with treating the fingers that are actually going to be injured. So just for demonstration wise, I'm going to just go through 2 or 3 fingers. I'm not going to go through all 4 or 5, and sometimes you will be working 4 or 5 fingers, 3 fingers. It depends on where the injury is. So for example, if you injured this middle knuckle and it hurts all around that middle knuckle, I know we're talking about the middle one, you would likely treat on both sides of these knuckles. So what we're going to do is we're going to start very gentle, working the non-affected joint first, just going back and forth, and then I'm going to show you an up-close view in a little bit too. And then what we'll do is we'll work the non-affected joint on the other side. The reason I like to work the non-affected joint first is so that I can create more loosening up of the joint in the middle. And then what I'll start doing is I'll start scooping. So what I'll show you here is I'll start scooping in just like this, really getting into that joint just like that. And then I'll go further, I'll work that finger that is affected on both sides, and including the flexor side, and I'll bend the finger as well, and I'll extend the finger as well. I'm going to work every angle here, so we don't want to leave what they say every stone untouched or unturned. We want to make sure that we really treat very thoroughly up into the fingers. We'll even treat the fingers of the non-affected side, because people will have better outcomes that way. Just come in and we'll do that same thing over and over. Doing a scooping motion. I'm going to change the tool to this double bevel side, and you can kind of see I'm using my hand to kind of scoop in there. So this is really good again for anybody out there who sprained a hand, sprained a knuckle, they're having other hand pain, or just want to keep their hands in, generally speaking, in good shape. So we said there's some muscles that go down into the hand and on the back here as well. So I'm going to go lightly over this side here. So we'll take a little bit of this, and what we're going to do is we're just rub some emollient there, rub some emollient there, and I'm going to shorten up the hand a little bit, and I'm going to position it just like this, just to work into this hand, into the joint, going light at first, not ever going so heavy at first, and then I'm going to switch back just to get a better grip on the tool. I'm going to kind of like have it like this in direction. And I'm going to curl the hand all the way, very gentle. If somebody has a sprained hand, and it's interesting because sprains are really just a lot of disruption to the tissues, but they can be extraordinarily painful, and they can be very, what we call, acute in nature, meaning they can have a lot of swelling, a lot of inflammatory chemicals, and what you really want to make sure is that you're not creating more damage and you're not irritating it so bad that the person is like recreating a sprain. So sometimes less is more, because really what you're going to be doing is just stimulating blood flow and stimulating the nervous system without increasing it in terms of like the inflammation. So really that's like as much as I would do on the hand. Maybe I'll work a little bit further down. But I'm going to go right into the forearm now. And the reason we'll go into the forearm is because the forearm flexors will come down and they'll interweave and become flexor tendons. And so if somebody's having front or back, of that hand problem, you may want to work front or back of that forearm, because there are going to be extender tendons and flexor tendons that go down into that palm. And because these are typically non-inflammatory, meaning these weren't the area of injury, you should be okay with working them a little bit more aggressive. But in the hand, if you're somebody who just suffered a hand or finger or wrist pain, you want to err a little bit more on the side of caution at first. You can always go back and do more, but if you end up doing too much, then you can't go back. So what I'll do is I'm just going to go right into here, and I'm going to just work a little bit of that flexor tendon. And I'm going to raise my my finger, my other finger, while I do these. And then you can add some stretch or something like that. You can work both sides. And you can add some stretch this way. Add some overpressure if you'd like. But this is how we would work the fingers or the hand if you're suffering joint pain in that finger. Remember, if it is some sort of inflammatory or acute related condition that you just did and you have some inflammation, keep in mind that you want to go a little bit less and be more anti-inflammatory in terms of nature, but you can aggressively treat the muscles that are not directly associated with that inflammation. So guys, this is a great technique. This is the Graston technique for hand pain, as well as a joint sprain of that finger. So amazing type of technology or tool that we use in our office. Definitely seek out a provider that is proficient in this technique. And thanks for stopping by, guys, and I'll see you guys for next episode. Take care. Bye.